The final structural classification of a joint is a synovial joint, a classification in which there are many subtypes. Here, we will not only discuss the different types of synovial joints, but also some of the structures that you might find within this type of joint. So the unique characteristic of a synovial joint is the presence of a space called a synovial cavity or a joint cavity between the articulating bones. Like a symphysis, the articulating bones of a synovial joint are covered by a layer of hyaline cartilage, which we call articular cartilage. The articular cartilage covers the articulating surfaces of the bone, so the surfaces of the bone that come into contact with one another during movement, to create a smooth, slippery surface, but not actually bind them together. Articular cartilage reduces friction between the bones in the joint during movement and helps to absorb a small amount of shock. Synovial joints are diarthrosis joints or freely movable joints, and there are 6 different categories of synovial joints, but we're going to touch on that later. What we're going to take a look at first is the accessory structures that you may find in this type of joint. So the example of a synovial joint we have here is the joint in the middle of the finger, or the proximal interphalangeal joint. This is the knuckle that is closest to your hand. On this figure, the articular capsule is this structure here, and then continuing along here. The articular capsule, which is sometimes just called the joint capsule, surrounds synovial joints like a sleeve, uniting the articulating bones. The articular capsule is made up of 2 layers, an outer fibrous membrane and an inner synovial membrane. The fibrous membrane usually consists of dense irregular connective tissue that attaches into the periosteum, or that outer layer of the articulating bone. The fibrous membrane is flexible yet strong, with the flexibility permitting considerable movement that we see at this type of joint, but the tensile strength working to prevent dislocation. The fibres of some of the fibrous membrane can be arranged in parallel bundles of dense regular connective tissue, which are more commonly known as ligaments. The inner layer of the articular capsule is the synovial membrane and is composed of areolar connective tissue with elastic fibres. Most importantly, the synovial membrane secretes synovial fluid. Synovial fluid consists of hyaluronic acid and interstitial fluid, which is filtered from our blood plasma. The synovial fluid forms a thin film over the surfaces within the articular capsule and functions to reduce friction, absorb shock, and supply oxygen and nutrients to, and remove carbon dioxide and waste from the chondrocytes, or the cartilage cells, within that articular cartilage. Synovial fluid also contains cells called phagocytes that remove any microbes and any debris that results from the normal wear and tear in this type of joint. Many synovial joints also contain accessory ligaments called extracapsular ligaments and intracapsular ligaments. As their names suggest, extracapsular ligaments lie external or outside of the articular capsule. Intracapsular ligaments lie internal or within that articular capsule. Examples of intracapsular ligaments include the fibular and tibial collateral ligaments of the knee. So that is this ligament here and here. Examples of intracapsular ligaments are the anterior and posterior cruciate ligaments, which you may have heard referred to as your ACL and your PCL, which are these ligaments here and here. Within the knee, we also find another accessory structure which is present in some but not all synovial joints. In the knee, this is called the meniscus. In other joints, the articular disc. The meniscus is a pad of fibrocartilage, which lies between the articular surfaces of the bone. It's thought to assist in shock absorption, to create a better fit between the articulating bones, and to help improve the weight distribution over a greater contact area. The meniscus of the knee is this part here and this part here. We also have the labra or the labrum as the singular. A labrum is the fibrocartilaginous lip that extends from the edge of a joint socket and is common in our ball and socket joints, which we're going to talk about later. The labrum helps deepen the joint socket to increase the area of contact between the socket and the ball-like surface of the head of the hip or the head of the humerus. So our labrum is just this little bit of cartilage here. This is our femur. We've got our ball here and our socket here. This little bit of cartilage helps just deepen that joint. Our last accessory structures are the bursa and the tendon sheaths. And so as our joints move and the bones articulate or move over one another, so do the ligaments, tendons, and muscles within this region. As all of these structures move all over one another, they create friction. Within the synovial joints, as they create the most amount of movement and therefore the most amount of friction, are sac-like structures called bursa, which are strategically located between the skin and bones, tendons and bones, and muscles or ligaments and bones to reduce this friction. Bursa consist of an outer fibrous membrane filled with a small amount of fluid. Structures called tendon sheaths then work to reduce friction at joints. Tendon sheaths, or sometimes synovial sheaths, are tube-like bursa. So you've got one side of the tube here and the other side here. These wrap around certain tendons that experience considerable friction as they pass through the tunnels which are formed by connective tissue and bone. So here we have the humerus or the upper arm. This is our bicep muscle and bicep tendon. As we contract that muscle and move our shoulder and our elbow, this tendon rubs up against this bone. So the bursa or the tendon sheath helps reduce that friction. So moving on to the different types of synovial joints, and although all synovial joints have many characteristics in common, the shapes of the articulating surfaces vary, and thus the type of movements permitted by the joints will vary significantly. Within the general classification of a synovial joint, the different subtypes are categorized based on the type of movement they permit. These subtypes are plane joints, hinge joints, pivot joints, condyloid joints, saddle joints, and ball and socket joints. So starting with plane joints, and the articulating surfaces of the bones in this type of joint are flat or slightly curved. Plane joints primarily permit back and forth and side to side movements, although sometimes they can rotate against one another. Examples of plane joints are the intertarsal joints between the tarsal bones of the ankle. So these are our tarsal bones here. So it's the joints between all of these flat or slightly curved bones. And then the intercarpal joints between the carpal bones of the wrist. In a hinge joint, the convex surface of one bone fits into the concave surface of another. So a convex surface is this part here that kind of sticks out. The convex surface is the part that curves in. As the name implies, a hinge joint produces an angular opening and closing motion like that of a hinged door. In most joint movements, one bone remains fixed while the other bone moves around an axis. So for example, this is our humerus or upper arm here. This is the bones of our lower arm here. These bones will move around the humerus. Hinge joints permit only flexion and extension. So flexion is bringing these bones up, extension is bringing these bones down. And we'll talk more about these movements in modules to come. In a pivot joint, the rounded or the pointed surface of one bone articulates with a ring formed partly by another bone and partly by a ligament. A pivot joint allows rotation around its own longitudinal axis. So for example, this bone here spinning around its long axis. Examples of a pivot joint include the atlantoaxial joint of the vertebral column. So this is where the atlas or the first vertebra rotates around the axis and allows the head to turn side to side, as well as the radio-ulnar joints that allow your palms to turn upwards and downwards as the head of the radius pivots around the radial notch of the ulna, or those two bones of the lower arm. You can see those bones here. In a condyloid joint, the convex oval-shaped projection of one bone fits into the oval-shaped depression of another bone. So this here is the oval-shaped or curved projection. It'll fit into a groove on the other side. A condyloid joint permits movement around two axes. So flexion and extension around one axis. So that's a joint getting smaller and then bigger. And then abduction and adduction around the other. So that's moving something closer to the midline of the body or something away from the midline of the body. It can be moving your wrist kind of side to side, either closer to your thumb or closer to your little finger. When these movements combine, we also have what we call circumduction, which is kind of moving things around in a bit of a circle. Examples of condyloid joints are the radiocarpal or the wrist joints. So these bits here, the carpal bones going into the radius. And also the metacarpophalangeal joints, which are the joints between the metacarpals or the long bones in your hand and the proximal phalange joints, which are the bones of your fingers. In a saddle joint, the articular surface of one bone is saddle-shaped and the articular surface of the other bone fits into that saddle, kind of like how someone would sit on the saddle of a horse. The movements permitted at this joint are the same as a condyloid joint, so flexion and extension and abduction and adduction, and then also when you combine those movements we have circumduction. An example of a saddle joint, and there are fewer of these types of joints, are the carpometacarpal joints between the trapezium carpal bone, or a bone in your wrist down here, and then the metacarpal of the thumb. Lastly, we have our ball and socket joints, which consist of a ball-like surface of one bone fitting into a cup-like depression of another bone. These type of joints permit movement around three axes. For example, we have flexion and extension, where a joint angle gets smaller and then larger. Abduction and adduction, where you're moving something away from the center or midline of the body and then closer towards the midline of the body. And then also rotation, which you can see is this part here, and a leg or an arm, for example, this is our leg here, can kind of spin. So you'd be pointing your toes inwards or pointing your toes outward. The two examples of ball and socket joints in the human body are our shoulder joints and our hip joints.